Hi, my name is Mary and I'm an occupational therapy assistant student at Bryant and Stratton College in Wauwatosa, Wisconsin. Welcome to our educational video on ambulating with oxygen tubing and a walker. As you may know, oxygen tubing tends to be clear, and when patients use it within their home, the oxygen tubing line is very long so it can reach all areas of the home. This poses a great fall risk as it's hard to manage and can get caught up on things. This video will go through ways to manage your line better, make it more visible, and help with advice for transfers and mobility within the home. The population this video is intended to be used with are individuals with conditions such as COPD, asthma, pneumonia, congestive heart failure, or other conditions which require them to use supplemental oxygen within their home. An overview of this video is that it will include some safety concerns to consider, how to properly put on your oxygen tubing, line management tips, tips for making the line more visible, and overall home mobility tips for those who need oxygen at home and use a walker to ambulate. Some safety concerns to consider while completing this video are to take frequent breaks while you're ambulating within the home environment. It is important to take breaks before you actually feel tired, because at this point you may be too fatigued to continue. Take them frequently and throughout exercises as needed. It is also important to be mindful of where you're ambulating within the home, as there may be other fall risks, including cords, rugs, open drawers, toys, or other objects that can cause you to trip. If you're using a four-wheeled walker with brakes and a seat for this trial, make sure that you lock your brakes before all transitions. The supplies needed for this video are the walker for ambulation, the oxygen tubing for practice managing, some tape for an adaptation we'll use, and a bed or chair or various surfaces within your home for practicing transfers. A pulse oximeter may also be a useful supply to have while completing this video, as it monitors your oxygen level and your heart rate. This will allow you to stay within the parameters as directed by your primary care physician. First, I will give an explanation of how to properly put on the oxygen tubing. Our tubing here, the two nasal cannula, curve one way. When putting this on, you want to make sure that the tubes are curved up towards your nose. You'll insert them into your nostrils, slip it over your ears, and then slide up the spacer so that it fits snugly under your neck, but not too tightly so that it's uncomfortable, but you do not want it loose so that it falls off. Just like this. Here's a close-up visual of what the nasal cannula look like. The curved part goes towards the nose. Some oxygen lines may have a little rectangle spacer at the bottom of the nasal piece. If that's how your oxygen line is, you'll rest that on the part below your nose, right there, insert the nasal cannula, and again, slip over the ears and slide up the spacer. Prior to starting this program, it's very important to make sure that your walker is set for the appropriate height. The way that this is checked is by standing up and hanging your arms at the sides of the walker. If you are unstable on your feet, it is crucial that you have assistance with this and a qualified professional holding on to your gait belt while testing this. The walker armrest should hit at the middle of your wrists. Go ahead and make sure that your walker is at the appropriate height at this time. This is where the walker should lay against your wrist. If your walker is not at the appropriate height, this is how a qualified individual can assist and adjust the walker to an appropriate height. Turn the walker upside down, and on the inside of the legs are little pegs that allow you to adjust the walker. Push the peg in and the leg down to make it shorter. Complete this on all 4 sides in order to make the walker the same height all around. I will now discuss a simple adaptation you can make to your tubing to make it more visible. Placing brightly colored tape along the line will make it more visible. I will be demonstrating with blue painter's tape. However, there are many brightly colored options available, and the brighter the tape is, the more it will draw your attention to the tubing on the floor. To make this adaptation, pull off a small piece of tape and place it around the tubing. Repeat this until there's tape about every foot along the line, just like so. Pause the video here for step-by-step instructions on this taping method. Now that you're prepared to complete mobility within the home, here are some basic line management tips that I will go into further with demonstration in this video. When holding on to the walker, always have the tube in your non-dominant hand to keep it out of the way. Tip 2. When turning, always turn towards the tubing to keep from getting tangled in it. Tip 3. Take the shortest and most direct route to areas in the home to prevent the tubing from getting caught or running out of slack. Tip 4. Eliminate unnecessary things on the ground that the line could get caught on. Perhaps the greatest fall risk that oxygen tubing poses is that it lays on the ground and gets tangled in things. A way to prevent this is to gather your tubing in your hand and only release excess tubing as you need it to walk farther within your home. Here is a demonstration of how to collect your tubing. You want to hold it within your non-dominant hand so that your dominant hand is available to reach for items as needed. To start, hold on to your tubing a few feet down so that there is enough leeway so that you can move your head and hold your arm at the side. Next, pull out your other hand and pull it back to your left hand. Repeat this along the line. Pull out and gather in your other hand. Pull out and gather. As you're doing this, you'll make loops that are about 2 feet long. Do this until all of the excess line is collected. Next, I will demonstrate how to do a safe transfer while holding on to the oxygen that you collected. As you typically do, place your hands on the sitting surface. Make sure that your feet are stable, about shoulder width apart, and push up from that surface. Grab onto your walker, and then grab with the non-dominant hand with the tubing in it. Next, I will demonstrate how to release the gathered tubing while you're walking within your home to gain more leeway.
Here is a close-up view of how to hold on to the walker with the tubing in your non-dominant hand.
You're holding steady onto the walker and drop down a few feet of the tubing. Keep holding on with your other hand as you release the tubing. This is how to do a bed transfer with your walker and oxygen. Gather as you go. Turn towards the oxygen. Touch the back of your legs on the bed. Reach back with your hands and sit down. If able to, move the walker out of the way and swing your legs up onto the bed. Here's a demonstration on how to navigate a small bathroom while still managing your oxygen line. It's important to note that when you're turning, you turn towards the oxygen line so as not to get tangled in it. Here is the demonstration.
Here is an example of what a narrow bathroom looks like. As you can see, the scale and the rug are in the way on the floor and could pose a great trip hazard while trying to ambulate with your walker and oxygen tubing. Remove those prior to ambulating within your bathroom. If you are unable to do so, find someone who is able to help you, such as a family member or friend.
See here that I will release a little tubing as I go. As I approach the toilet, I will turn towards the tubing. Again, reach back for that sitting surface and lower yourself down. When standing up from the toilet, again, push up with your hands and then grab onto the walker. Turn towards the tubing. When approaching the sink, again, turn towards the tubing so that it is in front of the walker and not behind. I will now demonstrate how to navigate within a room that has a piece of furniture in the middle, such as a kitchen island. In this case, you may have to backtrack and take a longer way around rather than continuing straight to your destination so as not to get tangled up around the furniture. If this is the case, make sure that you have plenty of spots for rest breaks along the way. I'm going to now demonstrate how to navigate within the room. I'm turning towards my oxygen tubing so it's still within my view at all times. Now, if I needed to go to the sink, which is over there, I will backtrack and go around the island so it doesn't get caught up around the base. Make sure to collect the tubing as you go. This is where it's good to have a place to take a seated rest break. This is the shortest route to the sink from where my oxygen line is attached. Again, turn towards the tubing and bring the walker all the way up to the sink.
In summary, always be aware of where your oxygen tubing is, leave only a short amount of slack whenever possible, and remove fall hazards from the environment. By following these 3 principles, you will be safer to ambulate within your home and manage your oxygen line. Thank you for using this video on oxygen line management. Therapists, we would greatly appreciate your feedback on the ease of use and implementation of this video. Please click the link in the description and fill out a short survey. Thank you.